Addiction ranks among the most stigmatized and least understood of the classified mental health disorder. A person with addiction uses substance or engages in behavior for which the rewarding effect compels the person to repeat the activity in spite of its detrimental consequences. A person with addiction uses substances such as alcohol, nicotine, cocaine, or engages in behaviors such as gambling. Welcome back to our channel. Today let us know about addiction disorder. Addiction disorder is a chronic mental health disorder with biological, psychological, social and environmental factors influencing its development and maintenance. There are two types of addiction. One is chemical addiction and the other is behavioral addiction. Let us first know about chemical addiction. Chemical addiction refers to addiction that involves the use of substances. Now let us know the common addictive substances that are used. Alcohol, opioids, cannabis, nicotine, amphetamines, cocaine, methamphetamine. Now let us know about the symptoms of substance use disorder. Cravings intense enough to affect your ability to think about other things. Need to use more of the substance to experience the same effects. Feeling of discomfort if you can't really access the substance. Trouble managing everyday responsibilities because of substance use. Spending less time on activities which you used to enjoy, inability to stop using the substance, and withdrawal symptoms when you try to quit. Second is behavioral addiction. Behavioral addiction involves engaging in a repetitive behavior or compulsive behavior. Now there is some disagreement regarding the concept of behavioral addiction, whether it truly involves addiction or not. However, the Diagnostic and Statistical Manual for Mental Health Disorder recognizes two types of behavioral addiction. One is gambling addiction and second is internet gaming disorder. Other behavioral addiction for which people seek therapy or professional help include shopping addiction, exercise addiction, food addiction, sex addiction, TV addiction, and social media addiction. Now let us know how addiction works. The first comes the reward system. Addiction interferes with our normal brain functioning. When we do something we find enjoyable, for example, hanging out with our friends, drinking a bottle of wine, or using cocaine, this reward system releases neurotransmitter dopamine along with other chemical substances. Contrary to popular belief, dopamine doesn't cause this feeling of pleasure or euphoria. Rather, it reinforces our brain's association with certain things and the feeling of pleasure that helps us to or that makes us to repeat this behavior in future. Second is cravings and tolerance. Now, the desire to experience this pleasure again can trigger the craving for the substance or the behavior, especially when one encounters the same cues. For example, a party where people are drinking. These cravings are the first signs of addiction. Third is disinterest in other activities. As addiction develops, it's common that the person loses interest in hobbies and other things which they previously used to enjoy. In spite of trying to stop using this substance or engage in behavior, people still continue to do this because they feel that if they don't do it, they won't feel good about anything. Fourth is loss of control. Addiction involves inability to control the use of substance or engage in specific behavior. This can lead to job loss, health issues, and relationship concerns among the others. Now let us know why people engage in addiction. First is biological factors. Under biological factors, genetic factors contribute about half the risk for developing a substance use disorder. Second is psychological factors. Under psychological factors, what causes addiction is trauma and abuse. Other mental health factors include depression, anxiety, attention deficit disorder, and post-traumatic stress disorder increase the risk of addiction. Difficulties managing strong emotion are also linked to substance use. Third is physical illness or disability. When people are physically ill or disabled, they tend to become limited in certain activities. This limitation may lead towards a depressed state of mind, which leads them to engage in addictive behavior. Specific to illness, people may use substances to reduce pain and other negative symptoms. Fourth is social or environmental factors. Having a parent or sibling with an addictive disorder raises the risk, as does a lack of parental supervision or support. Troubled parent-child relation, family disruptions such as divorce also add to one's risk. So does sexual, physical or emotional abuse. Second is accessibility factors. Third, peer group. And lastly, employment status. Now let's find out the treatment for addiction. First is psychotherapy. Under psychotherapy, cognitive behavioral therapy is mostly used for addressing the thoughts and behavioral patterns. Apart from this, family therapy and group therapy is also used. Second is medication. Third is rehabilitation. And fourth is support group and self-help group, who also helps in addressing this addiction problem. According to AIMS report, nearly 18 lakhs adult and 4.6 lakh children fall in the badly addicted category. Now, addiction is treatable, but relapses are common, so the journey may take time. This was the video for today. Thank you for watching our video. For more videos, stay tuned to our channel and don't forget to like, share and subscribe our channel.